जसप्रीत एक बार स्टार्ट कर दिया, एक बार चेक करना स्टार्ट है मेरे को, क्योंकि मुझे नहीं दिख रहा यूट्यूब पे। ठीक है मतलब यूट्यूब को बंद करके वापस चालू कर लूँ, यही ना? ओके, थैंक यू। Yeah, perfect. So I guess let's start with the day. First of all, it's a very important time that is going right now. You have an exam coming up very soon. So I would just very quickly brush up the implant section, because I know implants is something that always, because it's not been taught during the UG time also. So I'll just go through all the slides that we have already discussed from our implant section. And I would be slightly fast because I don't want you to waste time. If you want me to emphasize on some part or something, just write it on the chat box so that I'll just stop and explain it once again. Okay? So, yeah, let's start. Okay. So I told you, whenever a tooth is extracted, the bone around that tooth is known as bundle bone, and this bundle bone starts resorbing. And once this bone resorbs, the amount of bone that is left is less for implant placement. So they may ask you a question that which bone is resorbed if the tooth is extracted, and you need that bone for implant placement. So the bone that resorbs is known as bundle bone. Okay. So now let's first discuss the different components that are required for implants. So obviously first is an implant. This implant is made up of titanium. Why titanium? Because obviously it is biocompatible. It has good wettability. Wettability means when this titanium implant comes in contact with blood, it attracts blood, and this blood has lot of platelets. These platelets, they break and releases lot of growth factors, and those growth factors help in integration, attachment of that implant with the bone. Now this is based on the principle of PRF. You know that how is a PRF formed? The blood is centrifuged at 3000 RPM rotations per minute for 10 minutes. So what happens? It is divided into 3 layers. The bottommost layer is RBCs, the middle layer is PRF, that is platelet rich fibrin, and the topmost layer is PPP, that is platelet poor plasma. So the middle layer is PRF. So they may ask you a question about the different layers of PRF also, and at the speed at which that test tube is spun. So it is rotated at a speed of 2700 to 3000 RPMs for 10 minutes. Okay. There is one more type of PRF that may ask, that is IPRF. I stands for injectable PRF. So they may ask you one more question, at what speed IPRF is formed. So IPRF, that is injectable PRF, is formed at 700, the test tube is rotated at 700 RPM for 3 minutes. The initial PRF that we are, the test tube that we are rotating at 3000 RPM for 10 minutes, that PRF is known as LPRF. L stands for leukocyte PRF. अगर उसने कुछ भी नहीं पूछा है what IPRF, LPRF, then you have to give your answer according to LPRF, that is leukocyte PRF. So LPRF, that is leukocyte PRF, is formed when the test tube is spun at 3000 RPM for 10 minutes. And IPRF, that is injectable PRF, the test tube is spun at 700 RPM for 3 minutes. Okay. Now, because your implant is hollow from inside, just after placement of the implant, we put something over it, and this is known as a covered screw. So if they give you this diagram, this is a covered screw. So this covered screw will prevent anything from going inside during when the implant is osseointegrating with the bone. Suppose this is the implant that is placed. Okay, you will hold this implant with a covered screw, and you will close this implant cover screw. Okay, and this will prevent anything from going inside, and then you will suture it from the top. So this is the covered screw. Okay, now once this implant is placed, this suture is given. Up 3 months के बाद the patient will come to you. You will take the X-ray to see that your implant is integrated or not. If everything is fine, now you need to expose your implant. So this is a hex driver. They will give you this diagram and ask you what is a hex driver. So whatever you want to tighten over the implant, right now we are tightening the cover screw, or otherwise whatever you want to tighten over the implant is done with the help of this hex driver. So basically it is the screwdriver that is used in implants. Okay? So what is a hex driver? It is a screwdriver that is used in implants, that is placed over your implant, that will help for tightening of the components over your implant. So if they give you this diagram, so this is a hex driver. Okay, so this cover screw is placed. Now after 3 months, when the patient will come to you, because you have placed the cover screw, have given the suture. So it means after 3 months, when the patient will come to you, your implant will be covered with a soft tissue. Your implant will be covered with a soft tissue. It means after 3 months, I'll have to do second stage of my surgery. Means I have to give incision. I'll give one incision. I'll reflect my flap so that this cover screw will be visible to you, to me. I will take my hex driver, I will unscrew this cover screw, and this is how my implant will look, that is well integrated with the bone after 3 months. Okay, now what? Next step is to choose a healing cap. So healing cap is also known as a gingival former. Healing cap is also known as a gingival former. So now we will take our hex driver and we'll put our healing cap or a gingival former over the implant. Okay, so basically this healing cap, as the name suggests, it is known as gingival former, helps to form the shape of the gingiva around your implant. So it helps to create so this is how we have placed the healing cap. So it will help to create an emergence of gingiva around your implant. So an emergence of gingiva around your implant. So what is the role of a healing cap? It creates the soft tissue profile. It creates the emergence of soft tissue gingiva around the implant. Is it clear? So this is how the soft tissue profile has been created with your healing cap. Soft tissue profile has been created with an healing cap. So they may ask you what is used to create this profile. So options could be healing cap, healing abutment. Okay, so the answer here would be healing cap, healing abutment, or a gingival former. Okay, so this is a healing cap. So healing cap, this healing cap will help you to create the soft tissue emergence. Okay, now next, after placement of the healing cap, means my emergence is properly formed. Now the next step is to make an impression. Of this implant. So there are two techniques of impression making in implants. One is open tray and the second technique is closed tray. So open tray and closed tray. So the impression is made with the help of an impression post. The impression is made with the help of an impression post. So you need a component that is known as an impression post or an impression coping. Okay? So I told you there are two components, that is open tray impression technique and closed tray. So obviously you'll require two components to make an impression. One is open tray impression coping and the second is closed tray impression coping. Open tray impression coping and closed tray impression coping. Okay, so they will take this open. First of all, let's discuss about the open tray impression technique. So in an open tray impression technique, the impression post is placed over the implant, and you can see this impression coping has a long screw. So this open tray impression coping has this long screw. So इसको कैसे आप समझ पाओगे? If they give you a picture of this, which is open tray or which is closed tray. So open tray has a long screw and the closed tray has a small screw. So the open tray impression coping is placed over the implant. So, okay, the open tray impression coping is placed over the implant like this. Now Suppose let's take a full case to understand. The healing cap is placed. So after the healing cap is placed, the healing cap is removed and I can see a soft tissue profile formed around the implant. Now we'll take an open tray impression post. We'll place the open tray impression post over the implant. Now as the name suggests, open tray. So we'll have to select a tray that is open. So we'll create an opening in the tray where this impression post is coming. So we'll take a tray where we'll take either a plastic tray or a custom tray and we'll create a hole inside it where the impression post will come. Okay. So now we'll put light body around the implant, impression post, and we'll put the putty in the patient's mouth. Now जब तक ये tray patient के मुंह में है, material set हो रहा है, don't remove the tray. What we'll do is we'll take our hex driver and we'll unscrew this impression post. We'll unscrew this impression post. जैसे ही हम इसको unscrew करेंगे and we'll remove the tray, the impression post will be picked up inside the impression. The impression post will be picked up inside the impression. So that is why open tray impression technique is also known as pickup impression technique. Open tray impression technique is also known as pickup impression technique. Okay, so the second technique is closed tray. So open tray I think is clear to everyone. The second technique is closed tray. So for example, this is the same case. We'll take the closed tray impression post. I'll place the closed tray impression post over my implant. Place the closed tray impression post over my implant. Now, as the name suggests, it is closed tray. So I don't need to make any hole in the tray. So what I'll do is, I'll put the impression post over it. I'll put light body around it. I'll take a tray with the putty and I'll put that tray in my patient's mouth. As the material will set, I'll remove the tray. Now the impression post is still in patient's mouth. I'll remove that impression post from the patient's mouth and I will manually transfer that impression post in the impression. I will manually transfer that impression post in the impression. So that is why it is also known as transfer impression technique. It is also known as transfer impression technique. So in short, I have told you two techniques, open tray and closed tray. So open tray impression technique is basically technique in which the impression post is automatically picked up inside the impression, and in closed tray we have to transfer that manually. So what do you think, which is more better and accurate impression technique? So open tray, because it is automatically picked up in the impression, is a better technique as compared to the closed tray impression technique. Now in which cases closed tray is preferred? So in patients with less mouth opening, जहाँ पे मुंह कम खुलता है, in only those patients, closed tray impression technique is preferred. Okay, good. So there is one more thing. They may give you the picture like this, जिसमें red color का कुछ component होगा that is attached to the impression post. So they may ask you, what is this? So this is pattern resin. When you see anything red like this attached to the impression post like this is pattern resin. Pattern resin. Now what is this technique? What are they doing here? ये लोग क्या कर रहे हैं यहाँ पे? They are splinting this impression post. जितने impression post हैं उनको आपस में splint कर रहे हैं, जोड़ रहे हैं. So what is the advantage when they are splinting the impression post and when we are making the impression post cannot move inside the impression. The impression post cannot move inside the impression. So that is why this splinting is done with a pattern resin. They may ask you, why pattern resin? Pattern resin because there is no polymerization shrinkage in pattern resin. That's why composite or cold cure is not used. So if they ask you why pattern resin is used, because there is no polymerization shrinkage in pattern resin. So this is a pattern resin and this is this material that is used. It comes in powder and liquid form. So red color is pattern resin. Okay, so this is how you have to splint it. So whenever there is more than one adjacent implant and whenever you are making an impression for that, you have to join them, you have to splint them with a pattern resin. Okay, now once the impression is made, Now your lab needs something that replicates dental implant, because see, your patient has gone with the implant. Your technician, your lab does not have that implant. So now they need something to pour a model. So if they ask you what is this, this is a lab analog. Now what is a lab analog? In simple language, if I explain you, lab analog is implant replica. ये implant की copy है. So basically, this is a lab. This is a dental implant for the lab technician. This is a dental implant for the lab technician. So what the lab will do, they will take this lab analog. They will put this lab analog over the impression that you have taken, and they will pour the model. So this is just to show you. मैंने cross section करके बताया, the lab analog will be inside the model exactly where the implant is in patient's mouth. So it's exactly in the model where the implant is in the patient's mouth. So what is lab analog? Lab analog is implant replica. Okay. So these are lab analogs that are placed inside the model. Okay. Clear? Now to place an implant, place a crown over your implant, you need an abutment. Like normally when you do a crown cutting, what do you call that tooth? You call that tooth as an abutment tooth, and you place a crown over it. Similarly, over an implant also, you need an abutment over which the technician will make a crown for you. So there are two types of abutment. One is straight abutment. If you have placed your implant straight, the lab will make an abutment that will make a crown that is over it. So if your implant is straight, the lab will use an abutment that is straight. If your implant is angled, it's not straight, they may use an abutment that is angled. So the angled abutment, the maximum permissible angle for an implant is 25 degrees. The maximum permissible angle for an implant is 25 degrees. So generally the angled abutment that is available for different implant companies is 25 degrees. So this angled abutment is around 25 degrees. Why? Because the maximum permissible angle for your implant is 25 degrees. Okay. Now please remember, जब भी लैब ये दोनों तरह के abutment यूज कर रहा है, तो जो इसके ऊपर क्राउन बनेगा, जो प्रोस्थेसिस बनेगा, वो हमेशा सीमेंट रिटेन्ड होगा. मतलब उसको सीमेंट से चिपकाना पड़ेगा. The crown would always be cement retained. So in short, if they are using a straight or an angled abutment, the prosthesis will always be cement retained. तो lab से आपको क्या मिलेगा? ये abutment मिलेगा, and you will get a crown that the lab will cement over this abutment. Okay, so this is one abutment. There is one more type of abutment that is known as UCLA, because ये University of California में मिला था. This is also known as plastic abutment. This is also known as plastic abutment, and this is also known as castable abutment. This is also known as castable abutment because this abutment can be casted. आपको बस इतना याद रखना है, जब भी लैब ये abutment यूज करेगा, आपका जो प्रोस्थेसिस बनेगा वो स्क्रू रिटेन्ड बनेगा, सीमेंट रिटेन्ड नहीं बनेगा. So if the examiner asks you a question that if you want to make a screw retained prosthesis, which abutment you will use? You will use UCLA or a plastic abutment. And if the examiner asks if you want to make a cement retained prosthesis, which abutment you will use? You will use a straight or an angled abutment. Okay, clear? So this is cemented crown. Whenever you make a cemented crown, you will require a straight or angled abutment, and whenever you make a screw retained crown, you will require a UCLA abutment. Am I clear? Okay, good. So now let's go to different stages of surgery. So there are two types of surgery. One is one stage surgery. So what do I mean by one stage surgery? By one stage surgery means that from the time of implant placement to the time of crown, I'll just do one surgery. एक ही बार surgery करूँगा, that is during the time of implant. मैं second surgery करूँगा ही नहीं. It means जैसे ही मैं implant डाल रहा हूँ उसके साथ ही I'll place a healing cap over it or a gingival former, cover screw नहीं लगाऊंगा, so that after 3 months I can just open that healing cap or that gingival former and I can directly make an impression. So this is one stage surgery. Two stage surgery का मतलब होता है मुझे surgery दो बार करनी है. The first surgery will be during the implant placement and my second surgery would be after 3 months. जब मेरा implant bone से heal हो जाएगा तब I'll give one more incision. I'll remove the cover screw क्योंकि इसमें first stage पे मैंने क्या लगा दिया है, cover screw. So obviously my cover screw being small उसके ऊपर gingiva आ जाएगा. 3 months के बाद I'll give one more cut and I'll remove my cover screw and I'll place now my healing cap. So it means I have to do surgery second time during the prosthetic part. So that is two-stage surgery. So they may ask you a question that during one-stage surgery, what do you place over the implant? So you place healing cap. They may ask you a question when you do two-stage surgery, what do you place over the implant? You place cover screw first and a healing cap later on. So these are different stages of surgery. Okay. Now I told you about why titanium, because it is biocompatibility, it has good wettability, and I told you about PRF. So this is when the blood is centrifuged in at 3000 RPM for 10 minutes. It is divided into 3 layers. The bottommost layer is RBC, the middle layer is PRF, and the topmost layer is PPP, that is platelet poor plasma. It's a very important question that they have asked sometimes before in the exam. They may ask it again. So please remember, the temperature while drilling should always be less than 41 degrees centigrade, because at 41 degrees centigrade osteoblast starts dying. अगर टेम्परेचर 41 डिग्री सेंटीग्रेड से ऊपर हुआ, the osteoblast will start dying. Similarly, if the temperature reaches above 47 degrees centigrade, so the alkaline phosphatase, the enzyme that helps in bone formation, will also denature. So ideally the temperature should be less than 41 degrees centigrade, and if it reaches more than 41, osteoblast will die. And if it reaches more than 47 degrees centigrade, alkaline phosphatase will denature. So they can ask you कि किस temperature पे कौन सी cell पे effect कर रहा है. They can ask you this question also. So very important. Okay, now there are different grades of titanium. So please remember, जैसे जैसे titanium की grade बढ़ती है, उसकी strength increase हो जाती है, but the biocompatibility reduces. It means grade 5 has the maximum strength, but it has the minimum biocompatibility. It means grade 1 has the maximum biocompatibility, but it has the minimum strength. So it means we need a grade of titanium that has good strength also and good biocompatibility also. So most of the good implants are made up of grade 4 titanium because it has good strength also and good biocompatibility. So they may ask you a question, which has more strength, grade 5 or grade 2 or grade 1? So you should remember this. Grade, जैसे जैसे grade बढ़ रही है, strength is increasing, but the biocompatibility is reducing. Okay. So now the micro design of the implant. So the distance between two threads is known as pitch. The distance between two threads of the implant is known as the pitch of the implant. So it means if the pitch of the implant is less, my surface area of the implant would be more, because if the pitch of the implant is less, the number of threads over the implant would be more, and the surface area of the implant will also be more. So please remember, very important point, the distance between two threads is known as pitch, and if the pitch is less, the number of threads would be more, and the surface area of the implant would also be more. Okay, so very important point. Okay, I'm just skipping things that are not important and covering things that are right now important for you. Okay, now important anatomical structures and the distance from it. So this is the inferior alveolar nerve, or this is it runs in the mandibular canal. So they may ask you the safe distance between your implant and the inferior alveolar nerve. So a distance of 2 mm should be there between your implant and the nerve. And they may ask you, if your implant touches the nerve, what may happen? The patient may develop paresthesia of the lip, because this nerve supplies the half of the lip on that side. So the patient may develop paresthesia on that side. So the distance between your implant and the nerve should be 2 millimeters. Okay, this nerve comes out of the mandible through mental foramen. So this is the mental foramen. So now they may ask you this mental foramen. This is the mental foramen. What is this? On the picture, they can give you this OPG and ask you, what is this? This is the mental foramen. Now this mental foramen has a loop. Now they may ask you a question. What is the size of this loop? The diameter of this loop is 5 millimeters. They may also ask you how this loop runs. So this loop runs anteriorly, then it runs posteriorly and backward. Anterior, posterior, backward. Anterior, posterior, upward and backward. And this loop diameter is 5 millimeter. So if they ask you, if you want to place an implant near mental foramen, what is the safe distance? So you need to keep a distance of 5 millimeter away from the mental foramen to take care of this loop. Okay, so you don't drill into this loop. Is it clear? So you can see in this picture, this is the loop. This red mark is the loop. Okay. Okay. Now this is your maxillary sinus. This is the floor of the maxillary sinus. This is the floor of the maxillary sinus. And this is the crest of the alveolar bone. So your sinus is hollow. So once this tooth is extracted, the sinus starts pneumatizing on and it resorbs the bone below it. So you need this bone. Floor of the sinus ke niche jo bone hai, that is the bone that you need for placement of your implant. So if this height is less, so we call this bone as residual bone height. So the bone between the floor of the maxillary sinus and the crest of the alveolar bone is known as residual bone height. So you need a bone of around 8 to 10 millimeters to place an implant. If my bone height is less, so then we have to do a sinus grafting or a sinus lift. Now there are two types of sinus lift. So they have asked a question previously in All India also about sinus lift. So now you should know about sinus lift also. There are two types of sinus grafting. One is a direct sinus lift, that is also known as a lateral window technique. That is also known as a lateral window technique, because in a direct sinus lift we make a lateral window. जैसे कि आपने Cadwell Luke में सुना होगा, a lateral window is made and the sinus membrane is reflected and the graft is pushed and the implant is placed. So why it is known as a direct sinus lift? Because you can see that sinus membrane directly with your eyes. It's a direct vision. That is why it is known as a direct sinus lift. So whenever this residual bone height is less than 5 millimeters, you do a direct sinus lift. Whenever this RBH, ये जो height थी residual bone height, ये 5 millimeters या उससे कम है, you have to do a direct sinus lift. But if this bone is more than 5 millimeters, you can do a indirect sinus lift. Indirect means that sinus membrane is not visible directly with your eyes. So the site from which you do drilling, जहां से आप drilling कर रहे हो, उसी साइड से you will hit and you will create a space और वहीं से आप ग्राफ्ट पुश करोगे and you will place your implant. ये आप तभी कर सकते हो जब आपके यहाँ पे जो बोन है ये 6-7 मतलब 5 mm से ज्यादा होनी चाहिए. If it is less than 5 mm, हमें lateral sinus lift और direct sinus lift करना पड़ेगा। सिंपल, आपसे जो क्वेश्चन वो पूछेगा when is a direct sinus lift done? So when the bone is less, when the residual bone height is 5 mm or less, you may do a direct sinus lift. And when the bone is more than 5 mm, then you can do a indirect sinus lift. Is it clear? So this is a direct sinus lift. What you're seeing right now, lateral window बनाई, sinus membrane को push किया, यहाँ पे नंबर 2 पे ग्राफ्ट डाला, 3 में पूरा ग्राफ्ट अंदर डाल दिया है, जैसे ही बोन बन गई बाद में इसमें इम्प्लांट डाल दिया. That's a direct sinus lift. Is it clear? Okay. Now this part I am skipping. That's not very important. Okay, so just remember this chart. It is very important. See, there are 3 types of prosthesis, fixed prosthesis over implants. That is fixed prosthesis 1, fixed prosthesis 2, and fixed prosthesis 3. FP1, FP2, and FP3. So FP1 is when you are replacing a crown over your implant, and that crown is exactly of the same size as the natural tooth was. मतलब सपोज एक पेशेंट आया, उसका अपर सेंट्रल इंसाइजर फ्रैक्चर हुआ एंड यू प्लेस्ड एन इम्प्लांट, और जो उसके ऊपर क्राउन आप लगा रहे हो, दैट क्राउन इज एग्जैक्टली ऑफ द सेम साइज जैसे कि उसके नेचुरल टूथ था. वो क्राउन लंबा नहीं है. सो दैट इज एन आइडियल प्रोस्थेसिस नोन एज FP1 टाइप ऑफ प्रोस्थेसिस. ठीक है. सो इट इज हाईली एस्थेटिक. सो जो आइडियल और हाईली एस्थेटिक प्रोस्थेसिस है, दैट इज FP1. They may ask you a question, FP1 prosthesis लगाने के लिए how much space is required? So the answer is 8 to 10 mm. Very, very important. For FP1, you need a space of 8 to 10 millimeters. Okay. The second type of prosthesis is FP2. That is fixed prosthesis 2. अब suppose करो किसी वजह से थोड़ा सा bone loss हुआ है, and now when you have placed your implant, obviously you'll place your implant थोड़ा सा ऊपर क्योंकि there is some bone loss. Now to compensate that bone loss, you'll have to make a crown that is longer. थोड़ा लंबा crown बनेगा. And that complete crown is made up of white ceramic. कहीं पर भी pink ऐड नहीं किया है. तो वो कहा, उस तरह के प्रोस्थेसिस को क्या बोलते हैं? FP2. अगर मैं आपको एग्जांपल दिखाऊं, दिस इज FP1. इफ यू सी ये इम्प्लांट है, इस पे जो क्राउन लगा है एकदम आइडियल है, सेम साइज का FP1. अब ये देखो, ये लंबे लंबे दांत हैं, कंप्लीटली मेड अप ऑफ व्हाइट सिरेमिक, कहीं पर भी पिंक ऐड नहीं है. सो दिस इज FP2. दे मे गिव यू दिस पिक्चर एंड कैन आस्क यू ये FP1 है, FP2 है या FP3 है. सो बेसिकली ये क्या है? FP2. ठीक है. फॉर मेकिंग एन FP2 टाइप ऑफ प्रोस्थेसिस you need a space of around 8 to 12 mm. आपको कितना स्पेस चाहिए? 8 to 12 mm. The third type of prosthesis is FP3. FP3 में बस क्या फर्क है? इसमें पिंक भी ऐड कर दिया है. So FP3 is long prosthesis with the pink. So it has pink in it. जहां पे आपको जिस भी prosthesis में पिंक दिख गया, it is FP3. So for FP3, you need a space of 12 to 18 millimeters, at least 12 to 18 millimeters. So please remember all the 3 spaces. When you have a space of 8 to 10 millimeters, you can give FP1, 8 to 12 FP2, and 12 to 18 millimeters FP3 type of prosthesis. So FP3 has pink ceramic added to it. अगर वो क्वेश्चन बोलता है tooth is longer and pink is added in the prosthesis, answer would be FP3. Okay. Okay, now let's come to overdentures. So I'll just cover small thing about overdenture. See, one sec. Okay, so overdenture. So now suppose this is our mandible. This is our mandible. Okay, this is my mental nerve. This is my inferior alveolar nerve. this is my mental nerve, and this is my inferior alveolar nerve. So Mish said there are 5 positions for overdenture: A, B, C, D, and E. So what are the 5 positions? A to E. A to E. A, B, C, D, and E. B is this. This is C, and this is D. A, B, C, D, and E. So A is first premolar. A is first premolar. B is canine. C is incisor. D is canine on the other side, and again E is first premolar on the other side. So now, according to Mish, for an overdenture, if you want to place 2 implants, overdentures पर भी बहुत सारे questions आ रहे हैं. Last 2-3 साल में I've seen a lot of questions, so please listen it properly. So if you want to place 2 implants for overdentures, the position would be B and D. B and D means both the canines. If you want to place 3 implants for an overdenture, then the position would be B, C, and D. And if 5 implants are to be placed for an overdentures, then it is placed from A to E. A, B, C, D, and E. So please remember, for overdentures, these are the 5 positions. If 2 implants are to be placed, that is B and D. If 3 implants, then B, C, D. And if 5 implants, A, B, C, D, and E. Now first, what is an overdenture? Basically, an overdenture is a prosthesis that is a removable prosthesis. So it is a prosthesis that can be removed, by the patient. A prosthesis that can be removed by the patient is known as an overdenture. Is it clear? So for an overdenture, you need a space of at least 12 mm. Very, very important. For an overdenture, you need a space more 12 mm or more. You need a space of 12 mm or more for an overdenture. Okay. Okay. Let's now come to the next part. That is, yes, this a most important part in implants, and I am seeing one question every year from this chart. This is a chart from Mesh, so please remember it, recall, remember it, cramp it, do whatever you do, but you may get a question from this. Number 1, the difference between tooth and implant. So tooth has cementum, periodontal ligament, bone, everything, but implant, it is ankylosed with the bone. It has no periodontal ligament around it. Okay. In tooth and implant, in both, junctional epithelium is present. दोनों में ही junctional epithelium होती है. Tooth में the junctional epithelium is 0.97 millimeters. 0.97 millimeters. It is 0.97 millimeters. And in implant, it is 1.88 millimeters. कितना होती है? 1.88 millimeters. It means the junctional epithelium is wider. It almost double in implant as compared to a tooth. So a junctional epithelium is made up of hemidesmosomes and basal lamina in tooth. Okay, and in implants also it is made up of hemidesmosomes and basal lamina. But the structure of basal lamina is slightly different. In tooth, it has lamina lucida and lamina densa. And implant, it has lamina lucida, lamina densa, and it has one more, sublamina lucida zone. So they may ask you which zone is extra in implants in basal lamina of implants. So the answer is sublamina lucida zone. Okay, next very important point. In tooth, there are a lot of fibers, gingival fibers, around 13 different group of fibers are present. But in implants, only 2 fibers, circular fibers and parallel fibers, because none of the fibers will go and attach over the implant. The fiber will attach around the implant, but कहीं पर भी tooth implant पे attach नहीं होगा. So very, very important point, just 2 group of fibers are present, that is circular and parallel. Next, biological width in natural tooth is 2.04 mm, we know, and in an implant it is 3.08 mm. If in an implant it is 3.08 mm. It is a sum total of junctional epithelium, that is 1.88 millimeters, and connective tissue, that is 1.05 millimeters. So it is 3.08 millimeters. So they may ask you, biological width is more in implant or natural tooth? So it is more in implant. It is around 1.04 mm more. The vascularity is more in tooth, less in implant. Probing depth is around 3.05 millimeters in tooth and around 2.5 to 5 millimeters in implant. Bleeding on probing is more reliable when it is checked over tooth as compared to implant. So please take a picture of this or do whatever you want to do, but remember this chart. It is very important. Okay, let's go to the next part, that is bone density. Okay, so there are 4 types of bone according to Mish: D1, D2, D3 and D4. So I am showing you one chart. Just remember that chart. It will help you to solve all the MCQs. So D1, D2, D3, D4. So first thing is D1 is pure cortical bone. There is no cancellous bone in between. This is pure cortical bone. D2 is porous cortical and some trabecular, means most of the bone is cortical and there is some bone that is trabecular in between. D3 is thin cortical and mostly trabecular, and D4 is the softest bone that is mostly trabecular. Now they ask you, they compare this bone with wood कि D1 bone कौन से wood से मिलती है, कौन से wood से approximately same होती है strength के basis पे. तो D1 is like oak, D2 is like white pine, D3 is like balsa wood, and D4 is like styrofoam, very soft. D1 is mostly seen in anterior mandible, D2 is seen in mostly rest of the mandible and anterior maxilla, D3 is mostly seen in maxilla, D4 is seen in posterior maxilla. Now you can see this density of bone on a CT scan. So the value of CT scan is checked with HF value, that is Hounsfield value. अगर आपको कहीं पे implant डालना है उस साइड पे, if you are seeing the HF value, if it is coming more than 1250, this means it is D1 quality of bone. If it is coming between 850 to 1250, that is D2 quality of bone. If it is coming between 350 to 850, it is D3 quality of bone. And if it is coming between 150 to 350, this is D4 quality of bone. So they may ask you a question, if a patient wants to go for an implant at 3.6 and the HF value at that region is 890, what density of bone it is? The answer will be D2 quality. So please remember these Hounsfield values for MCQ point of view. Okay, am I clear? Okay, let's go to the next part. Okay, that is the key implant positions. So a very important part. Now they have started giving you questions or MCQs. Ki suppose there is a patient with missing 4 teeth. So how many implants you need to place and at what position you want to place? तो इसके 3 principle याद रखने हैं. पहला principle, no cantilever. So first principle is no cantilever. It means over implant you cannot give cantilever. Second is no 3 adjacent pontic. So this means over between two implants आप 2 ही pontic दे सकते हो, 2 ही pontic दे सकते हो, उससे ज्यादा नहीं दे सकते. Suppose मेरे canine to canine missing है, so it means there are 4 pontic in between. So I cannot do this. I have to place one more implant in between. So that is the second principle. The third principle is a canine molar rule. It means whenever a canine or a molar is missing, I need to replace that canine and a molar with an implant. So my canine and molar always require one implant below it. So अब क्या principle है? इन तीनों जो principles को एक sequence में आप लगा दो and you will get the answer of how many implants you want to place. So let's see this. You cannot do this. You cannot give cantilever. So let's go through all these principles to come to an answer. You cannot give cantilever. You cannot give cantilever. No cantilevers. Otherwise, your implants can also fail. So they may ask you, when you give cantilevers, what happens? So whenever you give cantilevers, there are biomechanical complications. What is biomechanical complications? Means there could be screw loosening of your crown, there could be screw fracture of your abutment, there could be implant fractures. तो ये सब क्या है? Biomechanical complications. तो ये क्यों है? Because of cantilever. So cantilever should be avoided. Okay, no cantilevers. No cantilevers. Next principle was, second was, no 3 adjacent pontic. So we cannot give 3 pontics over natural tooth also, and over an implant also you can give 1 pontic, you can give 2 pontic, because as the number of pontic increases, the number of force increases multiple times. So up to 2 pontics is allowed, but 3 pontics cannot be given. So that's the third principle. The third principle, second principle. The third principle is canine molar rule. It means whenever a canine or a molar is missing, always you need to place an implant below it. That cannot be a pontic. समझ में आया? जब भी आपका canine या molar missing है, so उसके नीचे implant डालना ही डालना पड़ेगा. Let's take an example. Suppose आपके 3 teeth missing है. That is lateral incisor, canine and first premolar. अब आपसे वो क्वेश्चन पूछेगा, how many implants do you require in this situation? तो पहला रूल हमारा क्या था? नो कैंटिलीवर. तो इसका मतलब एक इंप्लांट लेटरल इंसाइजर पे डालना है और एक प्रीमोलर पे. तो पहला प्रिंसिपल फॉलो हो गया. द सेकंड प्रिंसिपल इज बीच में 2 से ज्यादा पॉन्टिक नहीं होने चाहिए. तो एक ही पॉन्टिक आ रहा है तो वो रूल भी फॉलो हो गया. द थर्ड प्रिंसिपल इज कैनाइन मोलर रूल. सो कैनाइन पे आई कैन नॉट गिव अ पॉन्टिक्स, आई हैव टू प्लेस वन मोर इंप्लांट. इट मींस to replace these 3 teeth, I'll have to place 3 implants. समझ में आया? So this is how you can solve these MCQs. कि एक पेशेंट में ये टीथ मिसिंग है तो कहां पे और कितने implants डालेंगे. This can be done by these 3 principles. Next example. Central, lateral and canine is missing. तो first principle no cantilever, तो central और canine पे implant आ गया. Lateral is a pontic, तो second principle भी follow हो गया, एक ही pontic है. Third principle canine molar rule. So canine already has an implant. So 2 implants are sufficient here. Do you understand? So this is how you solve these kind of MCQs. Okay. Now the next question they ask is about AP spread. What is AP spread? AP stands for anterior posterior spread. AP stands for anterior posterior spread. Now what is AP spread? ये AP spread का प्रिंसिपल फुल माउथ इम्प्लांट्स के लिए वैलिड है. फुल माउथ इम्प्लांट्स के लिए, ठीक है. इसके हिसाब से क्या है, इस प्रिंसिपल के हिसाब से क्या है, सो आपने जो आगे इम्प्लांट डाले उस पे से अपन एक लाइन पास करते हैं, एंड वन लाइन विल पास फ्रॉम द पोस्टीरियर इम्प्लांट्स. इन दोनों इम्प्लांट्स के बीच का जो डिस्टेंस आता है, दोनों लाइंस के बीच का डिस्टेंस, दैट इज नोन एज एपी स्प्रेड. अब इस एपी स्प्रेड का प्रिंसिपल क्या है? वॉट एवर इज योर एपी स्प्रेड, सपोज ये 5 मिलीमीटर आ रहा है, इसका 1.5 टाइम्स, इस एपी स्प्रेड का 1.5 टाइम्स मैं यहां पे दोनों साइड कैंटिलीवर दे सकता हूं. Suppose it is 5, so I can give a cantilever crown of 8 millimeters here and 8 millimeters here. So वो आपसे क्या पूछेगा? What is AP spread? AP spread is the spread of the implants, and how much cantilever can be given? तो आपको simple answer करना है 1.5 times of the AP spread. अगर आपसे उसने क्वेश्चन पूछा कि आपका AP spread अगर 8 mm है, तो उसका आप कितना कैंटिलीवर दोनों साइड दे सकते हो? सो 8 into 1.5, that is 12 mm on both the sides. 12 mm of crown on both the sides. So this is AP spread. Is it clear? Okay. Let's move to the next question. Okay. Now they ask you what are the minimum number of implants in different situations. Suppose overdenture है mandible में, you need minimum 2 implants. Suppose maxilla में overdenture है, you need 4 implants. Maxilla में fixed है, you need an implant between 4 to 8. Minimum is 4, maximum you require is 8. Mandible में fixed है, minimum you require 4 and maximum you require 6. ठीक है. So this is how you will solve these MCQs. 2 for mandibular overdenture, 4 for maxillary overdenture, maxillary fixed 4 to 8 and mandibular fixed 4 to 6. Now next, safe distances. Please remember, implant and natural tooth should have a distance more than around 1.5 to 2 mm. Implant or natural tooth में distance should be around 1.5 to 2 mm. Inter-implant should be more than 3 mm. Inter-implant distance should be more than 3 millimeters. Inter-implant distance should be more than 3 millimeters. Implant 3, implant natural tooth should be at least 1.5 to 2 millimeters. Okay, now they may ask you a MCQ of calculation based. अब आपको क्वेश्चन देंगे कि 3 teeth missing है and you want to replace these 3 teeth with 3 implants. The total mesiodistal space is 22 millimeters. If the size of all the 3 implants is same, what would be the size of each implant? वापस से बोल रहा हूं, इस तरह के क्वेश्चंस बहुत आ रहे हैं, अभी ध्यान से सुनना. If suppose there is a patient with missing 3 teeth to be replaced by 3 implants, the total mesiodistal space is 22 millimeters. तीनों implants का size same है. What would be the size of each implant? Okay, so now first of all let's remove the safe distances. The implant और natural tooth, suppose यहाँ मेरा tooth है, implant और natural tooth का distance हो गया 2 mm, inter implant distance हो गया 3, inter implant हो गया 3 and यहाँ पर भी जो natural tooth है, implant और natural tooth का distance हो गया 2. So 2 plus 3 plus 3 plus 2 around 10 mm. So 22 minus 10 mm तो क्या हो गया मेरा safe distance. So I am left with 12 mm. It means to place these 3 implants, the total space mesiodistally that is left is 12 mm. अगर मेरे तीनों implants का size same है तो divided by 3, each size of each implant would be 4 millimeters. Is it clear to everyone? So this is how you will solve these type of questions. Okay, next important point, safe distances from implant of various vital structures. Inferior alveolar nerve, the distance should be 2 millimeters. Inferior alveolar nerve से safe distance कितना होना चाहिए? 2 millimeters. Mental foramen 5 millimeters. Nasal floor 2 millimeters. Minimum bone around an implant should be at least 1 mm. Minimum bone around the implant should be 1 mm. Maxillary sinus, you can touch the floor of the sinus, so you don't need to keep a distance from it. You can touch the floor of sinus. अगर आपके पास ऐसा कोई ऑप्शन नहीं है और ऑप्शन है 1, 2, 3, 4 millimeters, so the better answer would be 2 millimeters. ठीक है. अगर आपको न्यूमेरिकल वैल्यू चूज करनी है डिस्टेंस फ्रॉम मैक्सिलरी साइनस, then answer would be 2 millimeters. But अगर आपके पास एक ऑप्शन है, you can touch the floor of the maxillary sinus, that would be a better answer. Okay. Okay, let's now move to the drilling protocols. I'm just skipping the part that is not important for you right now. Okay, now see, the stability of the implant is checked in torque. मतलब आपने जैसे implant को bone में डाला, the stability of the implant is checked in torque. The value of torque is Newton centimeter, NCM. So if they ask you the good stability or the ideal stability of your implant, is answer is 35 to 40 Newton centimeter. 35 to 40 Newton centimeter. Now the second question that may ask you, that if your stability or if your torque is excessive, अगर torque ज़्यादा है, so what is the disadvantage? Suppose your torque is 70 or more than 70, 80, 90, 100. So what happens? It leads to micro fractures in the bone and can cause bone necrosis and implant failure. So excessive torque is not good for the implant and may lead to implant failure. So they can ask you a question by giving this diagram. What is this? So this is a torque ratchet. ये जो है, this is a torque ratchet. So you will always see a spring. This is a non-torque ratchet. ठीक है, जो भी torque ratchet होगा उसमें हमेशा ये वाली spring होगी, and there are numbers written on it. ये spring जिस number तक pull होगी उतना torque is achieved in your implant. Okay, so this is a torque and this is a non-torque ratchet. So the way by which you can understand in the picture कि ये torque है या नहीं, तो ये spring अगर है तो torque ratchet है, अगर this spring or this is not there, then it is a non-torque ratchet. Okay, now what are the different drilling steps? So the first drill that you use in your implant is known as a guide drill. क्या बोलते हैं इस drill को? Guide drill. So lens drill एक तरह की guide drill है. Lens drill is a type of guide drill. So what you see in the picture is a guide drill. So if they ask you, the first drill that you will use is the guide drill. After guide drill, the second drill is a 2 mm diameter drill and it is known as a pilot drill. So the second drill is a pilot drill. In case अगर उन्होंने पूछा which is the first drill that is used, and option में guide drill या lens drill option नहीं है, guide drill या lens drill option नहीं है, pilot drill ही option है, then the second best answer would be pilot drill. But if you have options में guide drill or lens drill, and that is also known as a Linderman drill, Linderman drill. So these are one and the same name, lens drill, Linderman drill और guide drill. ये सब एक ही नाम है. These are the first drill. अगर ऑप्शन में इनमें से कुछ भी नहीं है, then my best answer would be pilot drill. So ideally pilot drill is your second drill and the diameter of the pilot drill is 2 millimeters. Okay. Now after this, you will follow all the sequence of drills. Pilot drill के बाद there are different width of the drill. Whatever size of the implant you have to place, you will drill up to the same diameter. Suppose if I have to place 5 mm diameter, I will drill up to 5 mm. If I have to place a 4.5, I will drill up to 4.5 mm. Okay. So this is the first drill, that is a lens drill. This is a handpiece. This is known as a physio dispenser. So they may ask you what is the name of an implant motor, that is known as a physio dispenser. The drill is placed and it is drilled. The second drill is the pilot drill. After the lens drill, you remove this drill. So this is the second drill, that is a 2 mm pilot drill. This is a pilot drill and you will drill to the complete length. Okay. You will remove the pilot drill. Now you will take the next drill. So you don't skip steps. कोई भी drill को skip नहीं करना. So they may ask you, if you skip drills in between, what will happen? It creates a lot of pressure on the bone. Chances of bone necrosis will increase, and again the chances of implant failure would increase. So don't skip any drills. So drilling. I'm just skipping these pictures because these are same. You don't skip any drills. Okay. Now they may ask you one question. If the bone density is less, bone is soft, so what is done? So suppose if your bone is D4 quality or D3 quality, means the bone is soft. So how do you achieve good torque? So what do you do is you drill less. Suppose if you want to place an implant of 5 mm diameter, you will drill 4 mm as diameter or 4.5 mm as diameter, and you will directly place an implant of 5 mm. So you drill less and you place an implant of wider diameter to achieve a good torque. So please remember, when the bone is soft, you drill 0.5 to 1 mm less to achieve good torque, to achieve good stability. Okay. So this is a case in which, a delayed case in which the incision is given, and the drilling is done. So this is the first drill, that is my lens drill or the guide drill. Okay. Now once this drilling with the lens drill is done, this is my pilot drill. This is my second drill, that is my pilot drill. I'll go to the complete depth. This is my third drill. And because I am placing an implant of the same diameter of this drill. After this is done, this is my osteotomy that is created. I'll take my implant and I'll position my implant in the osteotomy. Now I'll take my ratchet to see the torque. So I'll put a driver and I'll take my ratchet. My ratchet spring is coming to 35. So it means I have achieved a torque of 35 Newton centimeter. And I placed a covered screw over it and I'll suture it. So this is two-stage surgery because एक तो अभी मैंने covered screw लगाया है. एक 3 months के बाद I'll uncover it and I'll place a healing cap over it. So this is two-stage when I am putting a covered screw. So when do I do a one-stage or when do I do a two-stage? So two-stage is done when your primary stability is less torque. When you do any grafting, when your patient is a smoker, tobacco chewer or any compromised case, आपको सब लग रहा है कि oral hygiene poor है, patient की tobacco chewer है, primary stability implant में कम है, I'll never put a healing cap. I'll put a covered screw. I'll close my site. I'll want that implant to heal without any interferences for next 3 months. So that's a two-stage surgery. One stage I will only do when I have good stability and all these hindrances are not there. So this is two-stage and this is one stage when I directly place a healing cap over my implant during placement of implant. Okay. And the last and the most important thing, there are two types of complication that can come over implant, that is periimplantitis and perimucositis. So periimplantitis is irreversible. It is like periodontitis. So when there is bone loss around the implant, that is periimplantitis. When there is problem in the soft tissue around the implant, that is perimucositis and it is reversible. It's like gingivitis. Okay? So that is all for implants. So I tried to brush up everything what is required for exam point of view. So just give your exam, sleep well, make sure you attempt your paper properly, don't make blunders, and all the very best. Thank you so much.